Thank you, Paul. We're good? Okay. So for the next 15 minutes, I'm going to be talking a little bit about how we went about developing a scorecard, which is a tool that we continue to use to help us move quality forward. So the first thing was to look at why we wanted to do this. And one of the things that's happened in the sector is we've moved from a sector where we had a lot of data, but it was different across homes, different across providers, to a sector where we have a lot of data that is the same because we all use the MDS 2.0 assessment tool. So we entered into a time where we were a little overloaded with data. It was, what do you look at? How do you sort it out? How do you make sense of it? What's important? What do you want to keep your finger on? What do you want to keep your eye on the ball for? And the other thing is we also moved into a world of public reporting. So we actually have a consumer base out there that is a lot more knowledgeable about our industry and the outcomes of our industry. And we needed to help our homes get prepared for that and be able to speak to the story of the home. So why did we go down the road of a scorecard? It was an easy way, it was a keep it simple approach to organizing data that is now publicly available. It's available to all the homes. We've got Kai-Hi, which is a source of data. And the scorecard helped homes sort through the data and to be able to actually see and focus on what was important to the business. It also helps support decision-making in the home. It supports our strat planning process, accreditation, and also our quality improvement efforts. And as we move towards a sector that's required to have quality improvement plans as of next year, it also helped us get ready to write those plans, identify what needs to be on those plans on the go forward. So how did we go about doing this? It was a corporately led initiative. We needed to look corporately at what we felt were important indicators or important data sources to have on a scorecard that really tells the story of a home's performance and where they're at, what are the opportunities for quality improvement exercises, etc. So we started out by building this tool piece by piece. It was not something we could put out right away because we all know that we work in a world where we're a little inundated with a whole lot of change that's happening. So rather than putting the entire content of the scorecard out at once, we built this at our administrator meetings, and we meet with our administrators every month. And at each meeting, there was a piece of the scorecard that got added. So it was a very gradual process getting to where we're at now. And it was an opportunity to help the administrators learn a lot about data and, what's BET? Why are we looking at a CA1 and a CA2 on a RUGS score? What are the clinical indicators that drive those RUGS pieces? So it was an opportunity to, number one, build the scorecard, but also, number two, to help educate and bring that knowledge base to the administrators of the home. When we first started doing the scorecards, they would go out to the homes and individual feedback was provided to the home on their scorecard as well, some items for them to look at. And as we've grown the scorecard, we've actually pulled back a little bit on the information that we corporately provide to the homes on the scorecard. And now we're at the point where the scorecards come out with the data on it. So they are corporately generated scorecards. And the homes are required to fill in the scorecard to provide information back to us to tell us what they're doing about what areas, what are their priorities, where do they see it, and is the scorecard really painting the picture of the story of their home as they know it and as their staff would know it. So it's an opportunity for the leadership team in the homes to also have that dialogue with the home team to ask them, does this story tell the picture that you are experiencing in our home? So what data did we include? First off, of course, we look at our RUG data. And it's always based on the past quarter. So the scorecards generally go out around the 15th of the month after the quarter ends. So for January to March, they'll go out somewhere around April 15th. And the scorecard collapses all the RUG data into the key items that really do factor into CMI. It's also looking at and helping homes understand that CMI is more than a funding. It is also looking at workload and what workload changes have happened in your home in quarter over quarter. So we look at the ADLs of bed mobility, eating, toileting, and transferring, because those are the basics of any RUG score. We look at clinical indicators. So are we capturing all the key clinical indicators, such as diagnoses, IV, parenteral medication, et cetera, that go into calculating out a RUG score? Indicators of SAD mood. Are we capturing those? Or in one of the responsive behavior sessions earlier today, there was a lot of talk about how we kind of normalize some of that behavior. So are we really capitalizing on and capturing the indicators of SAD mood that we're seeing in our residents? And then at the end, looking at restorative and rehab and where are our homes at with that? Wait, okay, thank you. So we might, for clinical areas, we might give them a percentage and say, does this make sense? We might look at people who are diabetics with injections 7 days a week, because we know that that's a key issue around our RUG scores as well, because it is a workload requirement. So are the numbers jiving with what they have? It's really helping to also drive our data quality on MDS. Because we're now able to ask the homes questions on the scorecards around, is the data telling us the story that you know? The next section in the RUG scorecard that we introduced was looking at the quality indicators. And before we could really decide what around the quality indicators that we're going to actually look at, we had to decide and make determinations of what data source are we going to use, because we all know that CIHI data is very old, but we also know that CIHI data is risk adjusted, and we also know that CIHI data is the data that's forming our public reporting. PCC data, for those of you who use PCC, yes, it's there. Yes, it's more readily available, but it's not risk adjusted. So there are differences between your PCC data and your CIHI data. So our decision was to focus on the data that the public would have access to. With the quality indicators, we took these one at a time at administrator meetings, and I would go through with the administrators, okay, so what's the numerator for your worsened stage 2 to 4 pressure ulcer? What's the denominator? So that they have a really good understanding of what residents go into the numerator, what residents go into denominator, and then look at also how is the risk adjustment done at CIHI, and also helping the administrators understand the concept of a rolling 4-quarter quality indicator. And why, when they look at their actual numbers of residents with pressure ulcers, it will be different than their indicator, because it does take time for that indicator value to change, as it is a rolling 4-quarter calculation. Again, our focus on this was understanding the story at the home. And it was not on good home, bad home, top performer, poor performer. It absolutely was not that. We wanted homes to really delve into their data, go back, work with RIDE coordinators, work with their teams to understand who's in their indicator. And the focus on the scorecard that we want back from the homes is, now that you understand your story, what are we doing about it? So we've added just recently as well quartiles onto our scorecard for the quality indicators, looking at homes that are in the first quartile. So that's, again, depending on how you work quartiles. If you're in the 0 to 25%, you're in the top performing in the homes, or of all homes in Ontario. So we indicate to the homes which quartile they're in, and then based on changes they've seen in their indicator, changes in quartile, and risk in the home, they then are required to prioritize using the priority calculator for residents first. So we've brought in all of our resident first tools into this and prioritize what they're going to work on first. We do display 7 indicators on our scorecard, but it's really hard to work on 7 indicators at a time. So we are asking them to really look at 2 indicators. And then these indicators once they've prioritized them, they actually get translated to their quality improvement plan that we've put in place, so that there is a tie between our scorecard and the quality improvement plans that our homes have in place now. The next section that we have on the scorecard, this is the area where they are required to document what they're doing on their indicators. And the next is urinary tract infections as our risk management area. So we're watching the ball on this. We ask homes to submit their infection control statistics on a quarterly basis. I total those for the entire corporation and then put on the scorecard the distribution of infections for that home as compared to the corporate totals. And we've had some very interesting findings from this. We've had homes find out that a particular wash has made a very significant impact on their UTIs. We've had some homes really find that proximity to admission and the first fall is a huge indicator of subsequent falls. So people who fall within the first 2 to 3 weeks have a much higher rate of falling subsequently. So it's really driving some amazing work in the homes and a lot of sharing. And I think that's one of the key things that's come out of introducing the scorecards in our homes is the sharing of information that's happening. The other area that we've just added is a section on ministry findings. Very important for homes to keep tabs on these. And the focus here is how are you sustaining the changes that you've made as a result of the ministry visit? It's not on whether or not the finding happened, but it's on how are you sustaining that change? Because we know that we tend to audit and audit and audit and find the same thing 3 months later. Yeah. We then added a section on education to track mandatory training completion because, again, very important to the home. There's a lot of mandatories now. There's a whole lot of topics. So this keeps it at the forefront. It allows our home administrators to know exactly where they are. The process, I develop the scorecards corporately and send them out. The home team, it is not one person in the home. It is not a RI coordinator's job to fill out the scorecard when they get it. It is a home team approach to looking at all these different variables and then feeding the information into the scorecard and sending it back in. So they get about 2 weeks after they receive the scorecard. The team needs to come together and work through it and figure out what they're going to be doing next. And it really has supported us utilizing our resident first tools and pushing them forward in our world. So what have we seen as a result of results? We've seen some very significant results. So this is our performance compared to all of Ontario. And as you can see, for most of our indicators, we were above provincial average. We've now come down below provincial average. And it's the result of a lot of hard work in our homes, but also helping people know their story. And that's what the value of the scorecard has been for us. It's knowing their story. Thank you.